Today is National Fentanyl Prevention and Awareness Day. Some experts anticipate the issue will get worse before it gets better. 25 News Now weekend anchor Adam Seibel takes a closer look into this deadly drug in a 25 News Now Extra.
According to the CDC, 107,375 people in the United States died of drug overdose and drug poisonings in the 12-month period ending in January 2022. Of those deaths, 67% involve synthetic opioids like fentanyl, which is mixed in with other drugs like cocaine, methamphetamine, and heroin. Oftentimes, users are unaware they're even taking fentanyl, hence it's a drug poisoning even though they overdosed. Justin Reed is the Assistant Chief EMS for the Cy-Fair Fire Department, an unincorporated community in northwest Houston, so he sees fentanyl firsthand.
How bad is fentanyl? Yeah, I mean, it's an absolute epidemic that's just hiding in plain sight.
The issue of fentanyl is a relatively new issue coming to the surface in just the last decade.
In 10 years of my career, I never saw a heroin overdose, much less a fentanyl overdose, not one time in 10 years. Since 2013, I mean, it's every day, right? There's not a single day that goes by that my staff, our team, we don't respond to an opiate overdose, and specifically now fentanyl.
So from none 10 years ago to his department now seeing over 1,000 fentanyl overdoses annually, a dramatic change highlighting how pervasive this deadly drug is all over the country. Wendell Campbell is an agent with Houston High-Intensity Drug Trafficking Area and is in the fight against fentanyl.
We've never dealt with an issue this big before. I mean, this is monumental what we're dealing with. Over 100,000 deaths in the last 2 years, back-to-back years.
Even for the law enforcement side, fentanyl has changed things, with agencies like HIDA and the DEA working to educate the public and fight fentanyl.
The reality is, I think, for our nation and for the state of Texas and every community across the state of Texas, is that fentanyl has changed everything.
So understand that fentanyl can be deadly in a very small dose, only 2 milligrams, enough to fit on the tip of this pencil. And oftentimes it's mixed in with other illicit drugs because of how cheap and profitable fentanyl is. Narcan can reverse an opioid overdose like fentanyl and is one of the few life-saving measures.
So Narcan is an opiate antagonist, and so what it does is it actually binds with the receptor to block and prevent the opiate from doing its thing without all the side effects. And so Narcan will reverse the opiate, the heroin, the fentanyl. It'll reverse the effect of the medication, which the effect of the medication is to put somebody to sleep, but really it stops their breathing.
Seeing fentanyl firsthand, Reed says it's only getting worse.
If we collectively, as Americans, as a society, don't do something to acknowledge that this is an issue, we're killing people every single day because we want to deny that there's a problem, and the reality is it's only getting worse.
So for this National Fentanyl Prevention and Awareness Day, understand the dangers and extremely high risk of death when dealing with illicit fentanyl. Adam Seibel, KAVU-TV 25 News Now.
Here's your viewer poll this evening. Scan that QR code on your screen to vote now. Here's the question. Do you believe enough is being done to address the fentanyl crisis? Yes or no? Let's look at the numbers. 11% of you say yes. 89% of you say no. We thank you for voting. We want to hear from you. Come to crossroadstoday.com/vote to take part.